Thank you. Dr. Houry?
Chairman Cassidy, Ranking Member Sanders, and distinguished members of the committee, thank you for the opportunity to testify before you today. 3 weeks ago, I made one of the hardest decisions of my career. I resigned from CDC. I come to you as a doctor, as a scientist, and a mom. For over a decade, I worked as an emergency physician, treating patients where I saw firsthand how illness and death devastate families and loved ones, and even more devastating when it's preventable. That's what led to my career in public health. I changed my focus from treating individual patients to protecting the nation. I served 10 years at CDC under 6 directors and 4 administrations. In each case, priorities shifted, but decisions were grounded in evidence, transparency, and consultation with the world's best scientists. That has changed. I resigned because CDC leaders were reduced to rubber stamps, supporting policies not based in science and putting American lives at risk. Secretary Kennedy censored CDC science, politicized its processes, and stripped leaders of independence. I could not, in good conscience, remain under those conditions. America's progress in health is one of the greatest success stories in history. A century and a half ago, life expectancy hovered around 39 years. Today, it is nearly double that. And we got there through vaccinations, through safer food and water, through smoking cessation, and through the quiet, steady work of public health in every state and county across the country. There is certainly still work to be done to improve the health of our nation, but when we erode the institutions and processes that deliver evidence-based interventions to detect, prevent, and respond to health challenges, as Secretary Kennedy is doing, we trade proven gains for avoidable harm. We know vaccines save lives, yet all 17 voting members of ACIP, the committee that sets vaccine recommendations, were replaced with critics. Flu campaigns were halted despite 270 pediatric flu deaths last season, the highest non-pandemic total ever, with 90% of those children being under or unvaccinated. We also saw the highest number of measles cases in 30 years, with 2 children dying. Instead of promoting vaccines, the secretary spread misinformation and promoted unproven treatments. CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the secretary, global flu sample submissions have dropped by 60% and COVID samples by 70%, leaving us with far less visibility into what's coming. At the same time, moving experts on birth defects and chronic disease out of CDC will fragment our response capacity. We learned during Zika, and more recently with Oropouche, that reproductive health expertise was essential in these complex infectious diseases causing birth defects. Due to the Secretary's actions, our nation is on track to see drastic increases in preventable diseases and declines in health. Trust and transparency have been broken. Here again, the problem is not too much science, but too little. I first learned that the Secretary had changed our CDC COVID vaccine guidance on an ex-social media post. CDC scientists have still not seen the scientific data or justification for this change. That is not gold standard science. The Secretary's office ordered the removal from our website of the CDC scientific document on thimerosal, an additive to vaccines that science has shown is not linked to autism, while allowing an unvetted presentation on thimerosal to happen at ACIP, containing scientific assertions that were not assessed for data quality and bias. That kind of last-minute alteration undermines confidence in the deliberations that follow and is certainly not radical transparency. While at CDC, I worked with thousands of the hardest working, dedicated people I know who come to work every day to help all Americans live safer, healthier lives. My goal today is to provide real examples of the damage CDC is experiencing and to offer constructive steps squarely within Congress's responsibilities. I look forward to your questions.